and thank you for joining us. This is part of the Sleep Matters series created by the Master of Occupational Therapy students at the University of Alberta Faculty of Rehabilitation Medicine. Today we will talk about the impact of bedding and soft furnishings on sleep. Firstly, we will present to you a case study. We encourage you to consider this case study as we go over our presentation. Jane is a second-year student. She has difficulty sleeping and often experiences episodes of insomnia. Jane sleeps on a hard mattress and complains that it is uncomfortable. Jane uses a soft, thin feather pillow. She has neck pains and back pains. Jane sleeps with a heavy woolen blanket and thick flannel sheets so that she can keep warm, especially in the winters. Jane often wakes up several times at night to adjust herself in bed and make herself more comfortable, which causes her to not feel refreshed in the mornings. Jane was prescribed sleeping pills by her doctor, however, has found them to not be helpful. Jane has also tried to follow basic advice about before bed activities, such as not being on your phone or watching TV before bed, and not exercising late at night, but still has no improvement in sleep quality. What can be done to help Jane sleep better? Sleep is important for all, especially overworked university students. We may not think about it, but it can impact our ability to cope with stress, think quickly, and function physically. For students, lack of sleep can disrupt memory recall, emotional resiliency, learning, and problem solving. Therefore, it may not be the best idea to pull an all-nighter. The model presented in the slide is the Canadian model of occupational performance, which considers how the person, the environment they are in, and the occupation all contribute to their level of functioning. Occupation is considered any activity an individual engages in, such as sleep. Personal factors and their environment can influence sleep, and in turn, sleep influences them as well. Literature shows that both external and internal factors influence sleep. For instance, temperature impacts sleep and can be targeted to promote sleep. There are three different types of environmental interventions that we will talk about today: bedding, mattress, and pillows.
The bedding that we use can impact our sleep quality. Literature shows that sleep can be improved when an individual uses clothing or bedding that offer less thermal insulation to their arms and legs. A weighted chain blanket was also beneficial for insomniacs in one study, and softer materials can be less stimulating to the skin, providing improved sleep. It is noted that 7% of sleep problems are related to an uncomfortable mattress. Current evidence shows that no significant correlation between the firmness of a mattress and sleep quality has been found among healthy individuals. This may be due to individual variation in comfort. Although soft mattresses were noted to decrease excessive compressive forces on joints, they may not be sufficient to support the pelvis and cause spinal misalignment. Firm mattresses, however, may maintain posture and prevent this from happening, but can also lead to pain and joint stiffness in the neck and back. Mattresses should be chosen to fit the individual's needs and preferences. A systematic review completed in 2015 did, however, state that a medium firm mattress can help with musculoskeletal pain and sleep quality as well. Lastly, evidence shows that mattresses that facilitate a spinal curvature similar to the standing posture resulted in better sleep quality. Literature shows that sleep can be improved by using pillows that facilitate reduced head temperature and support the neck to allow even distribution of pressure. Contrary to popular belief, down and feather pillows negatively impact sleep because they retain heat and do not provide adequate neck support. A better alternative would be to use orthopedic pillows that promote cooler body temperatures and support the head and neck. Occupational therapy can offer a dynamic perspective to sleep, as they integrate a client's medical and psychosocial needs with environmental demands or limitations. As sleep is an important occupation that can affect a person's physical, cognitive, and emotional well being, it is important as occupational therapists to address these sleeping problems. OTs are masters at adapting environments to suit individuals' needs, and the 3 interventions discussed earlier are some areas that OTs should consider.
There are no current governmental policies or clinical guidelines regarding the use of soft furnishings in sleep, but evidence from the literature can influence funding for appropriate mattresses and soft furnishings. So back to the case study. We've provided some suggestions on how to modify bedding and soft furnishings to address Jane's sleep issues. For example, switching from a feather pillow to a more supportive orthopedic pillow may improve neck pain and disturb sleep. This is a simple way we can positively influence a student's sleeping environment. Here's a list of resources available that offer moisture wicking and cooling bed materials. They have a variety of furnishings and mattresses that can fit your client's needs. The top 3 organizations listed have information on weighted blankets. There are 2 programs in Edmonton listed below that donate mattresses to individuals who may not have the financial resources for them. These are Sleep Country Canada and the Society of St. Vincent de Paul. Thank you for watching. We hope you can take away something from this presentation.